Good morning, everyone. Welcome, and thank you for joining us for this IHEAM webinar from Schneider Electric. My name is Victoria Emerton, and I'm the Conference Director for the Healthcare Estates Exhibition and Conference. Today's webinar will be presented by Chris Roberts, Director and Healthcare Solution Architect at Schneider Electric, and is called Driving Efficiency in Hospitals from Old to New. So we'll be using the questions function to take your questions today. This can be found at the right-hand side of your screen and is the icon with a question mark in a speech bubble. We won't have time to use the audience hands up facility, but please post your questions to the organiser and Chris will answer as many questions as there is time for at the end of the presentation. If you have any questions that you'd prefer to be answered privately after the session, then please send those to Chris via email. His details will be on the last slide at the end of the session. It's also worth noting that a certificate of attendance will be sent to all of those who watch the webinar in its entirety, so please do stay to the end of the questions session and the webinar platform will generate a certificate for you. There are 5 handouts that support the content of the presentation today. These are available from the Handouts tab in the panel to the right of your screen and can be downloaded during the presentation. We'd love you to visit healthcareestates.com for information on the other webinars that we're running in the next few weeks and the on-demand version of the webinar that we ran 2 weeks ago. You'll also be able to find information on IHEAM Digital Week, which runs from the 5th to the 9th of October. And there's a form on the website to submit content and get involved in Digital Week. So I'd like to hand over to Chris now. Thank you very much.
Thanks, Victoria, and thanks for having us, and thanks everyone for attending the conference. So a quick introduction of myself, as Victoria said, Chris Roberts. So I'm the Director and Healthcare Solution Architect at Schneider Electric. I've been with Schneider for almost 20 years. I'm based in the US, but originally from the UK. So I've worked in healthcare almost 20 years of the time I've been with Schneider, working at Manchester Royal Infirmary. I started at Dryburn Hospital in Durham. I've also worked on Royal Shrewsbury Hospital and also Edinburgh Royal Infirmary up in Scotland. So my career has really been spent in healthcare. It's a segment which I really get passion from working. I'm also the Vice President of the Association of Medical Facility Professionals here in the US, which is a similar organization to IHEAM. So I've been around these organizations for some time. So what we wanted to cover today in the presentation is really looking at, technology that we're seeing in the market and how technology can be used with new facilities, but also with existing retained estates to be able to drive more efficiency and be able to upgrade and provide benefits for the estates and the operations. So when we think of healthcare, and if we just look at a few kind of trends that we're seeing in the market, obviously this year has been quite challenging for most healthcare systems globally, and this has really been impacting how they've operated their facilities this year. But when we look at it kind of as a holistic view, what we've really seen is that, the healthcare market is starting to become more patient-centric. And when we talk about patient centricity with healthcare, what we're really seeing is a shift in how we're delivering healthcare to the population. So where we're seeing more easy access in the construction and the use of outpatient and community centres, so that patients can get better access into their health systems. There's also been a drive around more kind of retail and consumerism, and a generation that demands an easier way in which that they can interact with their health system and how they can provide or see information to their health. So things like Babylon Health, where we've seen coming into the NHS, is really a way in which can be driven to the consumer, and it allows us to get an easier access and an easier touch point into the health system. These changes and this drive towards patient centricity has really been enabled by technology. We've seen a huge shift in terms of how technology is being used in healthcare over certainly in the years that I've been involved in the market. Where we've seen things coming from, the consumer market, such as Fitbit, which has really driven people's own dedication and focus around their own personal health. But we've also seen, the introduction and the use of more electronic medical records. So where we've moved from a paper copy into more of a digital world, the electronic record has really driven the way in which health systems are sharing information, but really adapting technology to move into that new generation. It's led to medical IoT for things like virtual monitoring, where we now use things like Apple Watch, where we use our Fitbits to do things like glucose monitoring for diabetic patients. But it's also used to monitor a lot of vital conditions in patients when they're discharged after serious surgery or procedures. Obviously, with the pandemic this year, there's been a huge increase in the use of telehealth. It had been on the rise before this year, but one example that we have here from my region here in Massachusetts in the US is before in 2019, telehealth was around about 1% of their patient engagement, and that's now up at around about 86% of how much interaction they have with their population. It obviously won't stay up at that 86% as they start to introduce more elective procedures back into their system, but they're expecting that to be still a high level and a lot greater than the 1% that it was before. So technology is really changing. It's becoming more on-demand access for professionals. And we're really seeing a lot more kind of mobile devices and technology really at the bedside of that patient, where a doctor, a surgeon, a nurse has all the information relevant to the patient's conditions, but also to their historic information so that they can make very fast and accurate decisions at the bedside of the patient. The reason for the centricity and the technology driven is always going to come back to having better data-driven outcomes. We really want to be able to drive better outcomes for our patients. So how do we use that technology to get better intervention with how we treat our patients, as well as having retrospective insight and predictive power? But with all of this data, that infrastructure needs to be in place to be able to make sure that we can manage that data so that we can really drive use out of it. And when we think of the trends in the healthcare industry, it's really very similar when we're looking at how that infrastructure needs to change and be evolved so that it can support a lot of these adaptations and these changes in the market. So when we think of that infrastructure system supporting all that data that's being generated, we know that the healthcare system needs to be more connected. The growth of data is really increasing. And when we start to see this, digitization is really going to be an area in which we need to focus. It needs to be more affordable sensors being deployed so that we can get greater and more information coming from the infrastructure. We're seeing a greater need to be able to structure that data and taking what we call structured and unstructured data together and making sense of it. Once we've collected that type of data, how do we use it to interpret it and also drive more artificial intelligence and analytics so that we can be more insightful and have that intervention around the data that we're capturing. But also, the value of all that data is really about how we can solve real world problems. Where do we have inefficiencies and how can data be used as a way to gather insights so that we can start to look at issues and bottlenecks and procedural issues in our processes so that we can start to look at how we solve real world problems. In addition to having a more digitized infrastructure, the drive towards more sustainability is still very important. So how do we help healthcare facilities really with their carbon footprint and being able to help them reduce some of their energy consumption? At a time when climate issue is really important, in addition to what we're seeing with the pandemic, how do we drive the increasing need for things around self-generation of power, making that facility more resilient? In terms of if we did have a power issue or if we lost utilities to that building, can we use self-generation to be more resilient in that infrastructure? How do we do source management to be able to take various energy sources at that building or campus or estate level so that we can shift between solar generation, renewables, as well as taking information or energy coming from the utility grid? And it's about reliability. We know that healthcare facilities have to be extremely resilient and reliable with their services. So how do we make sure that with that self-generation and source management, we provide an infrastructure that's extremely reliable and resilient? And obviously, as we always push towards more energy efficiency, how do we make sure that when we operate these facilities, we're operating them efficiently so that we can also reinvest some of that energy saving back into other areas within the system? So it's really about how do we make that digitization and how do we make a facility sustainable when we see technology and we see the rapid change in how we think about our estates and how the health system's delivered. But when we think of a health system and we look back at the priorities and really what a health system's driving in terms of its focuses, we really know that their priorities are the same. They've stayed the same, the whole period through the COVID pandemic. But as we come out of this, it's still going to be a focus on patient outcomes and patient experience. how do we make the health system and the buildings that they interact with, their built environment, an area which is going to help with patient outcomes, but also help around patient experience? How do we make sure that we're, improving the financial operating budgets of that health system? Things like energy efficiency, but also how do we enable process improvement so that we can reinvest into areas that are really needing the investments from energy efficiency savings, etc. It's also about safety. We've seen this with the COVID pandemic, and when we talk about infectious diseases within an infrastructure, how do we make sure that we improve safety for both the patient and the caregivers by having an infrastructure that's really safe and secure, and making sure that when people go to work, it's a safe environment. It's not conducive to infectious disease or electrical risks. So making sure that we improve that safety and security. We also know that healthcare is very regulatory compliant, and so there's a lot of standards. So there's the CQC in the UK. There's the HTMs that we need to adhere to. So how do we help and use technology to simplify that regulatory compliance and help to reduce the risk in an organisation by using technology and identifying issues where we might have around compliance? And that really ties into when we talk about improving staff productivity. So how do we take technology and how do we focus on our staff that we have in our infrastructure within our building and make sure that they're focusing on the areas that need their focus, and using technology as a tool to be able to help them get to that productivity and to improving how they're doing their day-to-day operations. So when we think of those priorities and we think of how healthcare systems are using technology to drive a change, we still see that hospitals all have the same type of problem statement. All healthcare systems and hospitals, driving to be more digital. They want to be more patient-centric, but a lot of the times they're still hindered by the siloed nature of both their operating models, but also in terms of the procurement process for how they buy technology and systems. This lack of integration that we see sometimes, between the facility system, the clinical operations inside of a health building, as well as the administration side. Sometimes we see that can impede the ability to drive, high quality care and experiences. And this is really, a challenge that we see, in that a lot of the times the facility operations and the clinical operations are very siloed. We have a very robust and high-tech IT infrastructure for our electronic health records, but we may not have invested inside of our infrastructure systems. So we operate in different siloed budgets and different siloed systems, as well as all the clinical operations being very departmentalized inside of that building. So the collaboration in terms of how these organizations work, as well as how these systems integrate, is really a challenge because they're still very siloed. There's also, when we think of patient satisfaction and patient engagement, how do we use technology to be able to look at the lack of technology and resources that are really focusing on experience and engagement inside of that building. So when a patient's inside of that area, do we use technology to help them, navigate around that building with things like wayfinding? Do we understand, exactly how they're feeling inside of that patient room with satisfaction surveys, etc.? So using these technology can be an enabler to find out exactly how well a facility is doing around satisfaction engagement, but we still see that the technology, or the lack thereof technology, is really a hindrance in terms of understanding exactly what's going on inside of there. There's also, when we think of IT, clinical, the operational technology and IoT systems, there's a whole host of data that's existing and sitting inside of a healthcare building. The variety of that data is very different, but we see that there's little to no integration between these systems. So what's happening with your clinical information to do with maybe the admission of a patient can be used to drive things like energy efficiency around your HVAC, but there's little to no integration to enable us to be able to do these types of digital or digitization. There's also, when we think about having visibility across the environment of care of a hospital building, sometimes we can feel that there's little visibility or control across all the different aspects, to do with the clinical side, as well as the environmental side of that environment of care. And then when we think of construction, it's still very much a siloed approach. We have different initiatives, around PPP, PFI, where we've took more of a consolidated approach to construction and operation. But still, when we get into the construction market, we are hindered by some of the approaches in terms of the design, bid, build, where we look at energy engineering efficiencies or value engineering is a way in which sometimes we start to see the value for that customer is value engineered out in a way in which we can look at more cost-driven decisions around that construction process. So these are the problem statements that we typically see, and it leads to what we call chaos in terms of the data that remains inside of that healthcare building, where we see that we still have all these siloed infrastructures, and where we have all of this data which remains in chaos. It's there, but it's not structured, it's not being used, and it's not really driving value to that organization. And this is really driven by the traditional approach in which we've seen, where we would have multiple networks have been provided from different vendors, where we have a fire network which is installed, we have a building management system installed by a different vendor, intrusion detection, there may be energy management, and all these systems are installed in silos, where they're coming from sitting on different backbones or networks. They all have different vendors, so it becomes difficult in terms of training for that facility team, in terms of how they access, how they use, and how they understand all these different systems. Because we have a lack of sharing between these systems, they may be proprietary, there may be no scope in the contract to enable that integration. It can cause troubleshooting issues because we have different sources of data, different timestamps of information. So the cause and effect and the root cause analysis can be quite difficult to understand as we're analyzing data through different systems manually. It also leads to obstacles when we're trying to achieve energy efficiency, where we might have competing and also conflicting functionality. The example which we've seen in a lot of facilities is really around the lighting control system, where for a security officer, lighting is very much should be on to prevent any intrusions, or for the first security incident is to activate those lighting systems. Whereas when we're thinking that around energy efficiency, it's really about reducing the amount of lights that we can have on, so that we can reduce that energy load in the building. So understanding those conflicting and competing issues can be challenging, and it can lead to obstacles when we're trying to do energy efficiency or other types of integration and functionality. As I mentioned earlier, we have all these different systems. They all have relevant information for how they operate their system, but that information is also useful and valuable to be able to share. But in the traditional approach, we see that data is not always shared between systems. So then we get a lack of integration and interoperability, which can lead to all of the issues which we've mentioned above. As we move into new technology and we're seeing the rise of analytics, machine learning, artificial intelligence, and when we have data coming from all different systems, it limits that possibility because we're not consolidating that information. It's all sitting in siloed systems, and we start to see that we just have analytics within one function. So we don't start to see analytics across a building, but it's more a siloed approach to how we see that analytical systems being approached. So when we think of that traditional approach, and we think of a retained estate that we might have in the UK, we say, well, how do we go from that traditional siloed approach where integration is very much stuck within a system? How do we get it into an area where we can say we're now becoming more digital mature in terms of how that system operates? So when we think of the maturity curve, for technology adoption, we can see, on this chart that we have on the right-hand side, that really we have different levels of integration as we start to mature and develop across that maturity curve, which leads to different levels of smartness and advanced types of systems that we can put in place. But the first step in terms of the maturity curve is very much to start to connect and capture that data, where you can now say, okay, we've now enabled that infrastructure to be able to provide information. We've connected it so that we can now start to collect that data. And once we've started to collect that data, we can then start to say, well, how do we automate that information between the systems? So if we now have information coming from your HVAC system as well as your admission system, how do we automate the HVAC or the BMS inside of a patient room to make sure that it's on when a patient has been admitted into the system? The same with an operating theatre, where traditionally, it may have been that we've done a manual interaction to say this operating room is not going to be used for the rest of the day. Can we automate that system by integrating into the scheduling system for the operating room to say we know that there's no procedures after 11 o'clock today? So can we now automate that system and go into an energy setback mode? Once we've connected and automated, it's about what we call analyzing and acting. So now we're going to take that information, we're going to run analytics against that data, and we're going to analyze and see how we can act, be able to improve some of the efficiencies around our system. And that's where we then jump into what we call optimize, where we start to optimize our infrastructure by making automatic decisions after we've done that analyze and act. And this is really where we start to see machine learning, artificial intelligence really come into that infrastructure. The last step is really what we call orchestrate. And this is really about orchestrating that organization and that system by understanding the data we have, how we've automated our procedures, how we've analyzed and acted. So now we can start to orchestrate how that data is being used so that we can have automated procedures, we can reduce manual tasks. And it's all about making sure that you have an orchestration with your data, your people and your processes, so that you can be more efficient in terms of your maturity curve. And when we talk about digital solutions, it can be quite onerous and quite scary to look at how you can get that integration across your whole infrastructure. But the way with technology is really about modular approaches. By starting small, learn from that small deployment and see, how you've reduced your risk and how you can add smarts as required. Once you started doing modular, because technology is so scalable, you can then start to grow at your own pace. And it's really about having configurability into that modular scalable approach so that you can now start to address both new and existing estates by configuring that system in the areas which you want to focus and have the most attention. So the reason we have these digital maturity curves and the reason that we see that integration is so important is if we take a look at a typical patient pathway for a patient who's coming into a hospital, they're going to be admitted to the operating room for a procedure, and then they'll be discharged next day or 2 days later. But when we go through that whole process, we can see that all these systems are connected on the IT infrastructure, but the data that they're presenting and they're sharing is all relevant to how we manage our facility operations, but also about how it enables energy efficiency savings in that organization. So when a patient is admitted into a hospital, they're going to be registered in their electronic health record. They're going to go into the admission systems. But traditionally, once that has been done, the facility would have no view into that system in terms of what's happening with the patient. We don't understand the utilization rate or how many patients are allocated to that building. So it's hard for us to be able to understand exactly the energy profile. But once we start to understand that a patient has been admitted, they've been allocated into a certain bed, it may be a private single bed area in that facility. Can we take that information and can we start to look at optimization of the HVAC and the temperature and lighting inside of that room? If they've been admitted, do we turn the lights on, make sure that the temperature is at the set point, make sure we have the right airflow going into the area? So we take that information because we know the pathway and we know the procedure to be able to optimize some of the infrastructure systems. Once that patient is inside of that patient room, it's very much about creating an environment in which they're comfortable. So connecting back into the infrastructure, they want to have access, to things like streamed education, streamed content. You want to make them feel at home, but they also want to be able to control that infrastructure, control the shades in the room, control the lights, but also control the temperature between different set points. We know that a common call out for the nursing staff in hospitals is to do with temperature, too hot, too cold inside a patient room. So if we can provide the ability to control the room to the patient, do we start to alleviate some of those calls out for that nursing staff? Once we start to do the assessments and we're going to move that patient into transfer to the operating suite, it's about understanding, how do you get that patient from patient A, from area A to area B, where we want to make sure that we have the right communications and that we can connect and communicate with the transporting or portering teams within the organization. So using things like real-time location systems, as well as having interaction through things like mobile applications to the portering team, identifying exactly where that porter is, identifying what type of equipment is needed to transfer the patient and where that transfer equipment may be, can start to streamline some of the procedures in terms of how we get our staff to pick up a patient and get them to the next area as quickly as possible. As we improve these processes about moving patients from A to B, it's going to reduce some of the delays in getting patients to their procedures so that we can be more optimized and we can have better throughput when we get to areas like the surgical suite. Once that patient's arrived, again, using RTLS to make sure that we have all the right equipment in the room, but also making sure that the environment, we have the right airflow, we have the right temperature, humidity inside of that surgical suite for that patient who's coming with a preset procedure, to make sure that everything is optimized and ready for that process. Once a patient goes back into their patient room, post-op evaluation, and they're going through their discharge planning, a lot of the times, we see delays in discharging patients just due to, not having equipment. If they need a wheelchair, for example, to be escorted, out of the facility. So again, using RTLS, connecting, into those systems is going to optimize that discharge process for that patient. But once that patient's been discharged, it's also going to help, schedule the cleaning procedure. What type of patient was in the room, what level of cleaning needs to be provided, as well as then connecting back into your HVAC system to say a patient's been discharged. We can potentially now start to reduce the temperature set point in that area. We might want to make sure that we reduce the lighting levels, close the blinds, so that we can go into what we call mini energy setbacks, so that we can think about just connecting our infrastructure based on the pathway and the clinical information that we're seeing coming from those different systems. And the way in which we see that IT backbone really connecting is really it's an approach in which you can connect your integrated systems together. So when you look at a building, you can see around this chart that we have things like building management, we have video, we have energy management, we have fire safety, we have elevators or lifts. These are all systems that are going to be deployed or are going to exist inside of that infrastructure. But what we want to be able to do is to enable integration and interoperability. We want to connect them all together so that we can, share information and get that data, passing through the system through what we call an integrated control platform. So that once we've started to share that data through interoperability, we can think about developing use cases that bring value to the health system. What is the value of connecting your building management system and your nurse call system, for example? It may be that you want to do a response on a code blue, so you need that information between your two systems. You want to make sure that your admission system is connected to your building management, as we've said, for HVAC setbacks. So you start to now drive value, but by having that data integrated and interoperable, it allows you to be able to develop use cases over time that bring value to the process in which you're looking at. It also starts to create what we call a common source of truth. So we have a common area where we can consolidate all this data so that we can have better troubleshooting and fault finding throughout our systems. And with this data source that we start to generate, it enables better sharing of data so that we can look at analytics for things like asset lifecycle, but we can also use that data to reduce downtime of equipment, downtime of critical systems by just having the foresight and the analytics running against all of that data that we're storing. Really when we think about this, it's a platform approach. A platform approach is really, there to future-proof the building. As new technology comes to the market, we don't know what that technology will be in the next 5 years, but if we have a platform approach which is open and integrated, which kind of fosters interoperability, it means that as new technology comes along, we can start to integrate the systems, and we can have what we call the use cases are really going to drive more value. So it's really a new way of thinking in terms of how we approach the design and the operations of a building. It's a new way of positioning technology earlier in the life cycle of our decision making. And we really see this as what we call a solution-based design approach, where rather than thinking of the product and the hardware, it's really about saying, well, what are the patient needs, what are the patient pathways, and what are the requirements of that end user? Where are the pain points within our existing estate where we know we have issues, and how do we use the building, as an asset to enable some improvements around our pain points and enable improvements around the patient pathway. So the first approach that we really always focus on is who are the users of that building, and where are really their challenges, and what are we trying to achieve with those different types of issues. Once we've understood, the challenges, the pathways, and the building as an asset, what we really want to understand is what is the applications and the use cases that are going to bring value or value-added services to that organization. So with technology, we know that we can integrate anything that we want to integrate. We can deploy technology for just because it's a cool technology in the market. But what we really want to understand is how that technology is going to be used as an application to drive value-added services for the organization. How does it improve the patient pathway and the experience for that patient? How does it reduce some of the pain points around the clinical operations? So really making sure that that use case is driving the what of the organization and driving those value-added services. Once we've understood the whys and the whats, it's about the technology and the hardware and the services that we will deploy. Whether that's things like cloud technologies for analytics, what are the systems around the infrastructure that need to be deployed, what are the IoT technology systems and measuring points that need to be enabled. It's all about now understanding, what I should deploy and how I should deploy it in a scalable manner to be able to deliver on that function, that value-added surface, so that can improve some of the problem statements around patient pathways, around pain points, around satisfaction experience, and how I use that approach to really make it modular and scalable, so that I address the why, the what, and the how for the healthcare system's real mission and goals. And the vision in terms of how we want to be able to use that technology is so that we can enable healthcare systems to what we call truly transform into digital hospitals, that they can use a collaborative platform, which is going to really enable value-added use cases, which is really focusing on what we call out-of-the-box types of applications that bring value for both clinical and facility teams. But it's really an open ecosystem approach that allows you to be able to connect a variety of IT, OT, and IoT systems that are really going to drive value for that organization. It helps us to be able to bridge the gap between facility management and clinical operations. And we look at some examples of that in a moment. But it's really about taking that entire value chain of a hospital, from the facilities to the care team to administration, and really saying how do we use collaboration and value-added use cases to drive both process improvements, but also improve the way in which our infrastructure is really operated. So it tells us that we're moving towards more of a smart connected system, where we've said on that maturity curve, it's about connecting, collecting that information, it's about analyzing that information into meaningful insights, but most importantly, it's about closing that loop. It's about taking action from the information and the real-time business logic that we've collected, and really driving insights and action back into that organization. We can collect as much data as we like. If we don't understand it, analyze it, and use it to any value, that data is useless to us. So really making sure that we take action and close the loop so that we improve our processes. And what we'll do is we'll walk through a few examples. So we look at it from the estates and facility management perspective, and then we'll also look at some examples from clinical operations. So if we looked at the facility dashboard, so this is some metrics that you would see on the model hospital in terms of what data needs to be collected. Thinking of an organization who really needs to understand, what is their total backlog maintenance in an organization, but not just, what is the backlog that they have to work through, but what is their risk adjusted backlog? Where do they have high priority items they need to address? Which items, are significant that they need to take action of? And looking at that information is how do we break that down in terms of their physical condition of their facility infrastructure, as well as looking at where they might have compliance and regulatory issues. So by taking data from that infrastructure, you can start to understand and analyze your assets to be able to see, where you have risk inside of your organization on the data that you're collecting. It's also about, taking, active alarms in the system, typically coming from your building management system, your power systems, and really saying, what are the active alarms we have in that organization? Where do we have things such as data issues within the collection of our system? Where might we have harmonic issues or deterioration of metering devices? And making sure that the data we are collecting is very accurate, as well as understanding where we have events around fire, as well as things around health and safety. So when we think of a facility dashboard, it's about taking that information from that infrastructure, but really providing it back into an operational context so that we can understand exactly where we need to focus our attention around our high risk items, so that we spend our time not maintaining systems on a periodical process, but making sure that we focus on areas that are really at risk to our organization. And we have a few examples of how that can really be taken into real context. So this is where we see a minor fault in terms of your MDF or your distribution, your data center. Very commonly, we'll see UPSs that you may experience what we call bad batteries as they've been installed over time. We might start to get that red flashing light to tell us that there's an issue with that UPS. In most cases, these UPSs, are not connected, and they may sit, in that data center or in that IDF closet as we have here. They may be sat there, they're not connected. So when they get that bad battery, it's typically when we do a manual check on that system, when we see, that red flashing light. So a lot of the times it's something which it goes unnoticed in an organization, but it can have quite a heavy disruption on our systems. So if we had, for argument's sake, we had a power glitch which happened within the MDF closet, because we've got a bad battery on that UPS, it's going to cause disruption. It's going to take a lot of your health systems may go offline. It may be that imaging is unavailable, and this causes real safety and satisfaction issues for the patient and the staff by not being able to diagnose the patient properly because they can't get access to that health record. It could be more critical patients could be in danger because we can't prescribe them the right medication, for example. So it really impacts the safety and satisfaction inside of the organization. It's the same, if we're in maybe an IDF closet, where we're looking at main distribution or data closets inside the organization, where we have a UPS that's nearing its capacity limit. Because we see more and more IP or PoE types of devices within the industry, it's very common that when we start to plug in different IP devices, we don't think of the capacity on our UPS. So we start to plug in maybe new IP phones, and this can potentially overload that UPS. The network closet could go offline, which could take down a lot of your PoE systems. It could be your cameras, your phones, could even be the Wi-Fi system. So again, the disruption on that organization, could be that it disrupts the nurse call system, which is a critical infrastructure. It could bring down some of your network connectivity. So it could really impact, again, systems such as patient safety to, impact how patients and doctors are really accessing information for their patients. But it can also lead to satisfaction issues with, stream content for that patient in the room, or educational systems are not really being provided to the patient. So these are simple kind of minor faults that we call, that are presented within a UPS or within a device, but it's just not connected to the system. So when we think about how we can address that and how we can address these incidents before they take place, that might be seen as low risk in an organization. If we connect that UPS so that we understand, when we do have a bad battery in that system, or when we are, nearing the capacity limit, we can address that with services, or we can, send that notification into the facility team to say, yeah, this is a minor fault within an organization, but if we don't take action, here are the risks associated with it. And this is where technology can really be used in the background so that we can start to optimize some services. If a technician's coming out to site, they might say, we know there's bad batteries in our organization. We know that there are areas where we're reaching capacity. So let's not, ask the facility team what they want us to focus on today, but really, take insightful action and focus because we know there's an issue within that system. So this is where technology can really start to be used to analyze the systems and to connect the systems so that we understand exactly, where we have, minor faults within our devices, so that we can really schedule services to go out and take action and just, have parts and service techs dispatched, so that we can resolve these issues before they become major incidents. And this is really about technology just being connected, so that we can automate some of those procedures around service delivery, so that we can take action before they start to lead into major and more critical issues. Another example of technology is really when we're starting to think of, critical systems to do with your transformers. So, typically transformers and all your electrical equipment will be monitored, but it's not typically monitored, using analytics, etc. So here is an example of some analytics that we developed and we've run on a few hospitals around the world. And in this particular incident, what we found is that we saw that the C phase of that transformer on this dry transformer was running at a higher temperature than the A and B phase. What this was telling us is, in a typical scenario, that B phase would be the hottest and would be running at the highest temperature because of its physical location between the other two phases. But what it was telling us is that there's a potential insulation deterioration within the windings. So transformer, had not failed. So it allowed the facility to start to look at their scheduled replacement. They could then start to say, well, we know there's an issue. There's a potential for that fault on that transformer. So we can start to look at maybe doing some load shedding, reduce the load. But we can start to monitor it more closely so that the FM teams can take decisive actions on that system. This particular transformer that we had here was actually, data that we collected from a hospital here in the US. Who waited till the new financial year before they looked at changing that transformer. And unfortunately, on the 2nd, I think it was the 2nd of January, around about 2 o'clock in the morning, they actually had an electrical fire based on that insulation deterioration. So it caused a major incident. It was on public news here in the US, but it was something which could have been avoided because they had the information, but they decided to delay that replacement due to budget issues. So for a facility organization, this is very insightful data that can really be used as evidence-based information to drive decisions and budget decisions within an organization. The other example we have was when we had some partial discharge issues. So this was an oil fill transformer where we were starting to see some transient voltage spikes within that system over a period of, I think this was a period of around about 3 months, where we started to see these intermittent issues within that system. So by having the system connected back to a service bureau, our technicians were able to see these partial discharge events happening within that system, which could be causing internal arcing within the transformer. So where we start to see deterioration of that insulation, it's going to cause oil or it's going to cause gas within that oil transformer. So what we did with that system is we connected, we monitored the information because we provide service experts in transformer equipment. We recommended to the facility team, the recommendation was to do an oil analysis of that transformer so that they could really look at what they did with their changeover, or with their maintenance regimes. So when they actually did their oil analysis, they found very high levels of ethanol within their gas system. So they were able to take that information to be able to order a new transformer, take this out of line, so that they really avoided a potential catastrophe within. This was actually in their data center. So they were able to take that offline before they had a combustible transformer or an incident which would have took down their whole data center and disrupted their whole health system. So this is again an example of where that technology can connect. On a routine maintenance check, this was not being identified because it was intermittent issues within the system. So by having the analytics monitoring this continuously and having experts being able to analyze and provide recommendations to the organization, they were able to really take that insight and provide an analysis and see that there was a major issue that they could resolve before they had a major incident within the system. It's also, when we look at this, it's about connecting assets, it's about leveraging that data, and it's about reducing energy, but also reducing risk in an organization. So the examples we've shown have really been around UPS and around electrical systems, but this can also be connected into your HVAC system. So think of your ventilation systems, your boiler plant. By connecting all of your HVAC systems, you can start to have a look at how you can leverage that data to understand where systems are not performing the way they should be, looking at things around continuous commissioning as an example, but where you can leverage that data so that you can get better insights, so that you can start to optimize and move into what we call more of a predictive or condition-based maintenance regime. So it's about connecting assets, automating that data, leveraging that data, and then taking action and focusing on the areas that need attention, so that you can reduce risk inside of that organization. And the next few slides are really looking at kind of the hospital operations. So when we take kind of a typical hospital dashboard, and we're thinking of the nursing staff who may be working out in some of the different departments, how do we make sure that we bring all the relevant information together? And I think with the COVID pandemic, I think the focus around what's happening with things like temperature and pressure relationships is going to be more important as we move forward, and we see the new norm in organizations. But making sure that we present that data from all of the infrastructure so that staff members can be more efficient in responding to things like nurse call, understanding which rooms are available for housekeeping and cleaning, but also giving them information from the infrastructure, allowing them to see that the isolation rooms where they might have infected patients are safe. They're operating within the right parameters to make sure that they're not at risk of any type of infection. So consolidating that information to do with clinical operations around nurse call, around admission and discharge, but also bringing in the infrastructure data so that they know that the environment in which they're working is very safe and not conducive to things like infection. The other example we have here, and this is through some of our technology partners that we've worked with, a company called ThoughtWire, based up here in Canada, is really about how they can streamline things like workflow and transport activities. So I mentioned that when we looked at the patient pathway, but sometimes the problem statement could be that we have slow transport of medical equipment, or it could be of moving patients from imaging to the emergency room, which can have an impact on things like bed utilization. It can be a delay in the transport, or it can be delay in the treatment. So really what we're looking at here is how we can synchronize or streamline that workflow and that transport activity by understanding how many patient transports we have per day. Where are those transports going in terms of from the diagnostic suite to the emergency room, and then by using technology as a way to identify where that inefficiency exists, and then by using technology to improve the throughput, so that we can get better utilization of that system. And this is an example of how that technology would work, from a patient or nursing staff requesting patient transport, by identifying the patient, where that patient is going from area A to B, but not just where that patient is moving, but also what type of patient, are they an infection risk, what type of equipment do they need, so that when the transport staff or the portering staff get that request, they can arrive as quickly as possible. And then we can also put benchmarks and KPIs on place to make sure that we see when that transport was started and when it was complete. So it helps us improve efficiencies by just using technology and human interaction through that process of transporting patients from A to B. The other area is really about how we respond faster to events with the right types of information. So this is making sure that, we mentioned earlier that we have many different types of applications within a system that might have multiple logons. What we're doing is we're transporting information from A to B. So this is about making sure that we save time with that information by having alarms from multiple applications going to the right person at the right time, so that we reduce the need for unconnected systems, but we can make sure that we have the right visibility and the right data going to the right person at the right time. So this could be, making sure that we don't send facility requests to technicians who may be on a break, or we don't send nurse call alerts to staff members who might be out of the department. So it's making sure we send it to the right person at the right time to improve how we respond to patients and reduce some of the risk inside of an organization. So when we think about all of these different areas, for us, we call that integrated control platform Ecostruxure for healthcare, where we're really saying that the future of a digital hospital, it relies very much on collaboration, where partnerships are very important to make sure, not just with the health system, but with the design, the construction, but also with the technology that's deployed. And there needs to rely on a lot of collaboration throughout that process to make sure that our connected products that are deployed with inside of that organization, whether it's to do with your data center, whether it's your temperature sensors, are all the right products so that we can connect that information, and we can take it to what we call our edge layer. Whether that's the building management system, whether it's real-time location system, whether it's integration into things like third-party systems, admission, discharge, and transfer. But we're connecting that so that we can do supervisory control on our edge layer. And then ultimately what we want to be able to do is, with that data we've collected, drive analytics and services, and take action and provide insightful types of services back to that organization so that they can be better prepared, and they can be better optimized in terms of the procedures or in terms of the services that they deliver. So it's about making sense of big data. It's about having facility benchmarking. It's about providing better incident forensics and prevention. It's about having proactive fault detection, using that technology so that we can have things like predictive modeling, but also around things such as informed energy procurement. But by having that systems connected, we can make sense of that data so that when we think about the priorities and the needs of an organization, we can really say, well, here's the value of that technology, and here's how we will improve processes and performances in your system. Here's how we can define that functionality as an application, as a use case, and then here's how we can actually deploy and procure it as part of that construction process. So when we think of bringing world-class digital hospitals together, what we're really focusing on is making sure that the information is provided to the right person anytime and anywhere, so that they make the right decisions and that they provide the information that they're deployed in that organization to do, so that we can improve patient safety, we can improve patient experience in an organization, and then we can use that technology to drive better operational efficiency, so that we can make these world-class facilities more connected but also so that we can orchestrate how these organizations are really being activated and used. So that is really an overview. I think if there's any questions that we have in the chat, I'd love to be able to address any questions that you've had following that presentation.
So thanks very much, Chris. We do have some questions, actually, if we make a start. Anyone who has questions, please do type them into the question box. That's where we'll be looking for them. But we have a couple of questions to get us started. So a question from Muhand Abu Bakr. I hope I've got that right. It's very possible that I haven't. Apologies. So he is asking, how could we retrofit the existing technology system with a new integrated system for an existing hospital, since all the different systems have been installed before? And did this approach require reinstallation for infrastructure requirements?
So that's a good question, and I think that's a position most healthcare systems are in, and it really starts with what we call an audit and assessment of those systems that are deployed. Once we've done that audit and assessment, it'll determine whether we need to provide gateways or connectivity to those systems, so that we can start to look at how we either connect and start to drive insights from that data. So a lot of the analytics that we mentioned around the HVAC and the electrical, a lot of these systems can be connected to existing data points, but we may also need to do small-scale modernization of that infrastructure. And this is really where we focus on starting small and providing it not as a whole infrastructure upgrade, but where you can start to say, well, let's slowly start to assess and look at areas and where we need to modernize, and then we can start to scale that over time in a modular fashion.
Super, thank you. We've got a question from Dave Kilbride. So Dave's asking, what other non-healthcare sectors have you studied to understand their use of technology and their lessons learned to assist the healthcare sector?
So yeah, it's a good question. So within my personal study, we work very closely with a lot of our industrial colleagues in oil and gas, in food and beverage, where we've really seen their adoption of things like workflow and orchestration systems to better optimize how their facility teams are working. So we really analyze those different industries. Real estate is probably more following healthcare in terms of the technology. But when we look at healthcare, we're really looking at our life science colleagues. We're looking at what's happening, for example, in the hotel industry, which is where we took that best example from when you check into a hotel. You know that the person who's checked in, so you make sure that the TV's on with their name as they move into the room. We use that example to be able to connect into the admission system and do the same thing in the patient room. So we work with a lot of our colleagues around our industrial segments, oil and gas, wastewater, food and beverage, life sciences, and we really collaborate and see where they're getting insights, and we try to deploy that or use those examples in healthcare.
Okay, no more questions at the moment. Does anyone in the audience have anything else they would like to ask Chris? Just while everybody's thinking, we encourage you to go to healthcareestates.com, which will have the on-demand viewing of this webinar, the webinar that we did a couple of weeks ago. And we have 3 more scheduled for you guys to enjoy and to sign up for. So please do go to the Healthcare Estates website to see that and to find out some information about Digital Week, which is being run by IHEAM on the dates at the beginning of October when Healthcare Estates was originally scheduled to take place. We have a question from Graham Salmon. In developing your proposals, what obstacles did you encounter?
How long do we have to answer that one? I think a lot of the times, with some of our proposals, I think the biggest challenge we typically see is in the procurement process. So how different technology and packages have been procured. A lot of the times they fall. When we think of kind of the infrastructure, it's typically it falls under the mechanical contract for things to do with your HVAC and your BMS. You have your lighting control, your electricals under a different package, and then things like shade control, might be under a different package, furnitures and fabric. So we see that that's the biggest challenge that we see, is making sure that we have coordination across those different work packages, to make sure that they're all in agreement or they're all being coordinated, so that we don't have the HVAC system is trying to do one thing but it's not being included inside of the electrical package, for example. So that's the biggest challenge for us, really, is how we procure the technology today, and making sure that it's, when we do our procurement, it's not value engineered and cost driven by cost out of the scope.
Graham's also asking, was a lack of accurate asset information a factor?
It can be. We've seen that in a lot of organisations, particularly around when we want to make decisions and we're competing against budgets. For a new MRI scanner, for example, we don't always have, healthcare is very evidence-based, so we don't always have the evidence to be able to build up our business cases for some decision making. So the more connected assets we get, the more evidence-based decisions we can drive, which will help in terms of the decision making at a higher level in an organisation.
Super, thank you. We've got a question from my colleague Jonathan Bailey at the Health Estate Journal. So how early in the design and construction process do considerations around connectivity and effective data sharing need to be addressed? And how well informed do you find the architectural and construction community about IoT technology and edge computing, etc.?
Good question, and I think what we typically see is, if we're looking at the REBA plan of works, it's typically around stage 3, where we're starting to do things like conceptual design, where we really need to think about technology, because we're doing things like clinical and facility operation workshops. And this is where we really need to understand the process and the procedures, so that you can really understand how that technology is going to be used. And I think when we look at the industry today, there may be, excuse me, the technology providers probably, they will know more about the technology and how it can be deployed. So there may be a gap there between the architect, etc., understanding, the technology and the intricacies of it. So that's where we see the gap between their understanding of how we can deploy it and what's evolving, because it's evolving so quick. So bringing in a technology specialist earlier is really around that REBA plan of work stage 3 is really where we see the value and where you can drive all these decisions.
We have quite a few questions now. So Sarwan Madalia, again, apologies if I've got your name wrong, is asking, can asset tracking system be integrated into Cmms and IoT systems?
Yes, in most cases it can. So what you typically see with an RTLS system is it's connected into a lot of your clinical systems, your nurse call systems. It's connected into your electronic health record system. So it can be connected. In terms of IoT systems, it could be that you connect it into things to do with space utilization. It could be, you connect it into there. So yes, RTLS is pretty much integrated into all these systems. With CMMS, it's really going to, trigger workflows. So a lot of RTLS systems will have push buttons on their devices, so that you can trigger, a wheelchair or a gantry system might be out of use. So you use that RTLS system to then schedule a work ticket for some of your maintenance on those systems.
Super. We have a question from Adrian Hall. Adrian's saying, how open are trusts to the concepts of remote monitoring and data in the cloud?
That's I think what we've seen is that more and more trusts probably this year have been more open to having their systems connected, and they've probably been forced into having more kind of remote type of operations, so they'll have seen the value of that system. I think when you look at a lot of data that's connected on your electronic health record, a lot of this is cloud-based. You need to have it cloud-based in order to be able to drive the insights and the analytics. So I think the more and more the understanding in terms of cybersecurity and how cybersecurity can really be end-to-end from both cloud to the infrastructure, I think you'll see more adoption. There's more adoption as well in terms of cost of actually maintaining an on-site deployment of these systems as opposed to having it in the cloud. So a lot of this is going to drive the decisions around cost and around understanding around cybersecurity and performance.
Super. James Chadwick is asking, do you find that justification of the implication of the technology is easy to clarify in business cases for trust board approval? And have you got case studies to prove this in the UK?
So we can definitely share some examples of that in the UK. It has been a challenge to build that into the business case, and I think making sure that you work with the estate in terms of understanding where they have issues or where their pain points exist. As long as you start small and you build your business case on a modular approach, then you start to be able to have better justification as you go further through the cycle. So it's about identification first. So it's not about technology first. It's about identifying issues and procedural problems that exist. And then the business case is generally quite easy to validate and justify once you can show the improvements in that system. But that's a lot of the time when we talk about the kind of maturity curve, it's about proof of concepting that solution and bench testing it. So start small, show the value, and then that justification becomes easier with inside of an organization.
Thank you. I have a question from Haris Zahid, who's asking, are there any examples or case studies in terms of financial savings due to Ecostruxure integration versus independent systems?
Yes, we do have some examples of that we can probably share with you. I don't have an answer to give you exact numbers and case studies, but we can definitely provide some of that insight.
I think anyone wanting specific case studies from Chris is well advised to drop him an email, and then you can get some specifics between the two of you via email. So we've got two more questions. Christina Hooley is saying, hi Chris, the integration is definitely a huge drive going forward. Can you mention positive cases in which other vendors and manufacturers have collaborated to build applications with Schneider as a partner and system integrator?
Yes, so obviously we mentioned a few examples. Was a technology partner we have called ThoughtWire, who are a Canadian-based company. So we've partnered with ThoughtWire to do a lot of our optimization. So they provide a lot of healthcare types of systems where they have integration into clinical systems, etc. So we can provide that. We can provide that integration. We've also partnered with Brandon Medical in the UK, where we can provide more optimization of the operating room through their touchscreen panels, so it can really drive efficiencies and drive IoT adoption inside of the OT room.
Okay, we have more questions coming in. So Martin Owen is saying, what is the level of cybersecurity rating within the Ecostruxure?
So with cybersecurity, we standardize on EN 62443, but we also have that is really very much through our whole life cycle of cybersecurity. So we have cybersecurity through manufacturing of our products, all the way through to how we provide, the SL1A all the way through to SL4A types of security in our systems. Our systems and our products conform to that standard, but a lot of it has to do with how it's deployed and how it's configured on site. So we do have cybersecurity end-to-end within our system. We have best practices for how that system should work. We also have guidance around when we do integration into other systems. We always provide cybersecurity testing, penetration testing, and we're always doing conformance testing on our systems. Cybersecurity is always going to fall into the operator's hands once that system's been handed over. So with Ecostruxure, we'll have things like password policy, password length, or all these different types of requirements that fall out of the EN 62443 requirement.
Thank you. A question from Mark Richards. In an existing hospital environment with existing systems installed, how do you overcome the problem of the different protocols used by different manufacturers?
That's traditionally been a challenge and one of the areas where it's hindered integration. So depending on what systems are in place, most HVAC systems that we see today are going to standardize on BACnet, or there's Modbus within those systems. So these open protocols and the adoption makes it easier. Where we have proprietary types of systems, we need to look at how we develop gateways or how we develop drivers into those systems. If I give you an example, when we look at integration into things like nurse call systems, we'll develop things like TAP protocol, or we might have web services protocol. So we can build and we can develop APIs into more systems. But if it's a legacy system, we would look at how we could potentially modernize that interface, or we would build specific drivers into that system.
Great, thank you. We have run out of time. Thank you so much, everyone, for your questions. Thank you, Chris, for getting up very early in the States to deliver this webinar for us this morning. And we hope everyone stays safe and well, and we hope to see you for our next webinar in 2 weeks' time. But in the meantime, thanks very much again, Chris and Schneider Electric.
Thank you very much.